Welcome back to Real Moms, Real Stories, Real Savvy. I'm Ramey Cornell.
I'm Emma Brown.
Our first segment today is one that I feel really strongly about. As you know, Emma, I had a C-section, and I have to be honest, I really felt, and sometimes still feel like a failure because I wasn't able to go through this amazing process that everybody talks about.
Really? Honestly, I think lucky thing. But I guess the grass is always greener, isn't it? I suppose we've got to remember at the end of the day, he was born safe and healthy, you're safe and healthy. Healthy baby, safe delivery, that's all that matters.
Absolutely.
I had to have 2 C-sections because my kids were so big. The first one, I tried to have natural birth, and I was in labor for, I think, 12 hours. Finally, the midwife came in, and she said, "This baby is not coming out of you." And they rushed me into an emergency C-section. Sure enough, 9.5 pounds later, 22 inches long, there was no way she was coming out.
Well, there are several indications for cesarean delivery. There are elective and then non-elective indications. The elective, meaning we plan it and the woman knows she's going to have a C-section, would be in scenarios such as a twin pregnancy where the presenting twin was not head down, breech or transversely in the uterus, placenta previa, the placenta is covering the cervix. These women cannot deliver vaginally and would require cesarean delivery. They would know that before they went into labor. Then there are those which we discover when a woman is in labor, when labor is not progressing well because the baby is too big to fit through the birth canal, or there's signs of fetal distress, meaning the baby's heart rate is not reassuring during contractions. These would be situations where we would move towards cesarean delivery during labor.
I remember pulling myself up by the back of my bed, trying to sit up, and nursing with all of that going on. It's painful. It's doable, you know, and especially when you have that goal in your head of, I'm going to nurse no matter what. I think so many people are apt to just go ahead and give it up. But I think if you keep telling yourself that this is the best thing for my baby and it's the best thing for me because it helps in your recovery process, getting your uterus back to where it needs to be, that is definitely a goal that is attainable.
A mother's commitment to breastfeeding will determine really her success. So if she's committed, she knows that's what she wants to do, it'll work out. Sometimes an emergency cesarean, it takes you a long time to get the baby to breast. Do not worry. When you can breastfeed, start. Nurse frequently. And even though you may feel like your breast doesn't have milk or colostrum, whatever, it's there. And the most breastfeeding you can do in the beginning will help your milk production flourish as days go on.
We tried it with all 3 kids. We were successful with 2 out of 3, so I think a lot of it depends on the baby. Some babies take to it quicker than others.
The ideal positioning for a mother who gave birth via C-section would be lying on her side. That's the most comfortable. As the days progress, particularly the first week, it is more difficult to move around because you do have an abdominal incision. It just requires maybe a little bit more help at home, like someone bringing the baby to you or getting comfortable first using lots of pillows. Also doing the football hold where you hold the baby on the side.
You are very tender, obviously, in your midsection after a C-section, so kind of hold the baby's head here and you kind of put the body to your side rather than having the baby's body kind of lay across your stomach just because you know it is so tender after surgery.
Usually after the first week it gets better, the second week definitely better. By the 3rd or 4th week you're able to move around a lot easier.
The hardest thing right after the C-section is getting out of bed for the first time. It absolutely feels like your insides are about to fall out. Getting in and out of cars, just standing up, sneezing, coughing. Picking up the baby sometimes is tough too. You've got anywhere from 4 to 8 inch incision across your belly and you need to just kind of be cognizant of that.
The key is to really listen to your body and to advance your exercise or activity as you can tolerate it. It really depends on your physical condition going into it, your general nutrition, whether you had any complications, whether you had significant blood loss, etc. For an uncomplicated cesarean delivery, I tell my patients not to drive for 3 weeks. They may resume some walking or aerobic activity after 3 weeks, not to use their abdominal muscles for 6 weeks. But once again, I always tell them to listen to their bodies, and if it hurts, don't do it.
I think a mother who has a cesarean might need more time to emotionally recover, particularly if it was an emergency type cesarean birth. It is very traumatic. And sometimes moms who had their heart set on deliver vaginally and then it ends up cesarean, they might feel just a little bit more weepy than others. It's very common.
I can see how women can feel like that's being taken away from them, because it is something that only us women can do, is give birth. For me, it was just, I had pushed for 2.5 hours. I was so close and they could see her crowning. So it was difficult. I would have liked to have had that experience.
If women go into labor with an open mind and a willingness to go with the flow, as it were, I think that they would have a much more positive experience. If they perceive that somehow they've failed should they have a cesarean delivery, they would deal with that in a much more difficult fashion. Attitude is everything. What we all want is a healthy mom and a healthy baby, and whatever we have to do to achieve that is really what we need to do.
I knew probably a month before we delivered our first child that it was going to be a C-section. I didn't feel like I missed anything, just because to me the greatest reward was becoming a mother, and that's what I had gotten pregnant for. There's a lot of women who maybe have birthing plans that for whatever reason don't work out. I think as long as you keep your eye on the most important thing, which is becoming a mother and having a healthy baby, all the other things really just become secondary in my mind.